Right. Word roots. So this should be chapter 2. Chapter 2 in your textbook. Right. Word roots and combining forms. They're going to list tons of them in this presentation. I'm not going to go through all of them. I'm just going to give you mnemonic devices and hints on to learn a few of them. So it's up to you. Make your flashcards and practice. So anytime you're at a stop sign, pull it out of your front scrub pocket, do the list real quick, stop light I should say, put it back, just have them with you all the time, keep on practicing. So the standard, we have prefix, word root, suffix, combining form. So for this word we have pathy, so that's a condition or disease. Peri is around, like the perimeter, and then cardi is heart. So you got some kind of disease around the heart. So heart, cardiopathy, condition of. So you have a condition of the heart. Oh, they didn't put epi. I'll put it in. Combining forms. They say 70% in this class, pretty much 99% of the time. Prefix and suffix, modify. So here are two examples. So this is a specialist in the study of the heart. And this one would be a specialist in the study of the nerves. So yeah, specialist. Neuropathy. So neuro is the word root. Pathy is the suffix. So we have a condition of the nerve. Here they changed it a little bit to make it make more sense or easier to pronounce. Sometimes you'll do that, rearrange it a little bit. Itis, inflammation inside the head. Encephalitis, inflammation inside the head. E is for exiting, right? So this is going to be removal of the tonsils, surgical removal of the tonsils. Put them together. So again, they remind you Greek or Latin phrases. I'm not going to go through all of them. I'm just going to go through a few of them. Blast or blasto, that's an immature cell. And just remember, B is for build. So if I'm a young bone cell, I'm a blasto cell. I build bone. So that's one way to remember your alliteration. Blastocytes build bone. They're immature cells. Cartilage, chondro. So right here in your rib cage, all your ribs connect to your sternum via cartilage. If you ever had baby back ribs, that white crunchy stuff, those are the rib tips. Those are the ends where the cartilage is. Let's see. Chyme, probably the one you should know. Chyme is food that's mixed with acid. So when it's all churned up, that becomes chyme before it gets into your intestines. So sometimes they'll call it acid chyme. Cysto is cell. Cyst is bladder. We had this earlier for the gallbladder. So we have blastocyst. That's going to be an immature cell. Any cyst. Glyco, different sugars. So glucose is just sugar by itself. When they say glycogen, that's more complex sugar. Bunch of sugars linked together. Hydro with the Y is for, what if it's hydro with an I? Sweat. So that's totally different. Really different. Lipo, we had it earlier in hybrid 1B. So you see it again, a little repetition, hopefully it helps you retain. So what is both suction? What are they sucking out? Fat, right? They're not using their lips, they're using a machine to suck out the fat. Let's see, salpingo. So no longer fallopian tubes, they call them the uterine tube or uterine salpingo. So no more names of whoever discovered the body part. Somato, soma. Think of body. Anytime you hear the word soma. Squamous is scaly. So the top layer of skin is actually called the squamous layer. You have squamous skin cells. Pain. Algio, algae, algae. You guys are probably more familiar with without pain. Analgesics. You ever heard of that term? An analgesic is a drug like Tylenol or morphine. It's against pain. Let's see. Anesthesia, again, another one you guys are more familiar with. Anesthesia, against or without sensation. Not just pain, but all sensation. Pain, pressure as well. Kinetic, kinesis, that's movement. So kinetic energy is the energy of movement. The opposite, static. Static is not moving. Static is staying the same. So the study of motion, kinesiology. So kinesis is motion. Just think again of kinetics. That's motion. Phone is easy. Talk to a phone, their sound. Take a photograph, a little light. With the sonogram, how do we look at things? What do we use? Yeah, we use sounds. So the baby, sonogram, we're using sound waves, and when it bounces back, we'll determine the image. Andro for men. Androgens. Androgynous. That's what I was looking for. So Miley Cyrus, she has that androgynous look, right? Short hair, skinny, looking like a man. Let's see. Chromato. That's color. Chrome. Just think of chrome. There's used to be film, like Kodak, Kodachrome. So that's all dealing with their color film. Bodies. When you hide dead bodies, what do you hide them in? In a crypt, right? Cryptic writing, cryptic message. It's all hidden. Cyan is blue. Hold your breath, you become bluish. They call that cyanosis, a condition of being blue. Know your colors. Very important. So erythro is usually your red blood cells. Eosino, there's other types of blood cells that also stain red. Eosino. And then granular means if they're filled with granules or not. So if you have a cell and there's a bunch of dots in it, that's what they mean by granules. If I am agranule, that means I don't have any. I'm empty. There's no dots in them. Homo or homeo is the same. What's the opposite? Hetero, right? Heterosexual, homosexual. Luke, white. Just think of Darth Vader. Luke, I am your father. Takes off his mask. Pale guy underneath. Micro, think of macro. So learn them in opposites, large and small. Melano's black or dark. Your pigment cells are your melanocytes. They produce the pigment melanin. Learn those in tandem. Not too bad. Morph, you guys are familiar with. Pseudo. What's a pseudonym? A false name, right? So pseudo, anything's false. Pseudoephedra. It's not ephedra. It's kind of like it. Sclera. So that's hardening. Also describes the heart whites of the eyes, the sclera. Scoliosis, kyphosis, and lordosis. Those are spine curvatures. In the case of scoliosis, that's sideways. That's lateral curvature. The Hunchback of Notre Dame has kyphosis. So Quasimodo has kyphosis. And then if you have a swayback, that's lordosis. Think of J-Lo. Staph. Strep. So what's the difference between a staph infection and strep throat? It's just based on the morphology, the shape. What does it look like? So bacteria comes in round balls, they come in rods, they also come in spiral shape. So if you have a cluster of them, then that's a staph infection. You guys heard of a staph infection, right? Like MRSA? Yeah, that's what they mean when they say staph. So if you have a staph infection on your skin, they take a piece of it and they look at it and they see a bunch of great balls floating around and they go, oh, most likely it's going to be Staphylococcus. Whereas Streptococcus, in the case of strep throat, you're going to have a chain. So instead of a cluster, you might have like a string of pearls. That's how they'll grow. And then if they are just two, and then they're just diploid. Sometimes it's just two hanging out together. Monster, terato. Teratogenic. So if it causes birth defects, then that literally is defined or translated as monster making, the making of monsters. Teratogenic. Cruel? It's just by definition. Bacillus. So we have coccus, which is round. Bacillus are rods, rod-shaped bacteria. Who's the Hunchback of Notre Dame? I think they spell it with a Q, but it has the same K sound. So Quasimodo has kyphosis. J-Lo has lordosis. Cancer. Another term for cancer is onco. So your cancer doctor is oncologist. Cancer? Carcine. Yeah, there's two. Yeah. Carcinoma is a cancer. But we do, yeah, they just call them oncologists.
Prefix, suffix, or root word?
These are word roots.
Word
Yeah,
roots,
this
okay.
chapter 2 is just word roots.
So it's a couple of them. So
Oh, for a cancer? Yeah. So you can have carci, you can have onco, a tumor ends in oma. So that's kind of like a cancer too. So if it ends in oma, pretty much a cancer as well. Schizo is splitting, right? Like a schism. So schizophrenia is splitting of the mind, literally. We'll go to the body positions when we get the image. So anterior is front. The opposite of that is posterior, right? Spanish speakers, how do you say right in Spanish? There you go. So dextro. How do you say left? There isn't any. So dorsal is back. So think of the shark. Dun-it, dun-it. When it swims, it's the dorsal fin that sticks out of the water. Lateral, to the outside of the body. Medial is towards the midline. So your outer thigh, that's called the vatus lateralis because it's on the outer side, lateral position. Medial, that's in the middle. Now that you guys know anterior, posterior, medial, lateral, what is your ACL? What is your PCL? You guys heard of this in sports?
ACL, ain't that the Achilles heel?
No, that's in your knee, LCL. So you have stabilizing ligaments in your knee joint. So I'm going to draw a nasty knee joint. So, if I'm in front, which one am I? If I'm a ligament in front, which one do you think I am? Yes, if I'm in front, I am the anterior crucial ligament. So if I am the ligament that's on the back side, which one am I? Posterior on the back. Posterior crucial ligament. If this ligament is on the medial side, so on the inside of your knee, then that is the MCL, medial collateral ligament. And then if it's on the outside, then that's your lateral collateral ligament. So anytime you hear a sports report, somebody got their knees blown out, it's usually ACL, MCL, right? That's because if you get hit on the outside, right, your MCL pops, right? If you get hit on the outside of your knee pops open. You break your MCL, and then it usually strains your ACL as well. Planes of the body. So really easy. If I make left and right portions, then I am the sagittal plane, right? So any cuts here that makes left and right portion, that's sagittal. Now if I said equal left and right portions, then that's going to be the mid-sagittal plane. Right? So sagittal is any left or right portion. Equal left and right portion, that's mid-sagittal. Next easy one is going to be frontal. Right? If you make fronts and backs, guess which plane you are? Right? If I cut my body this way, there's a front half and a back half. That's just the frontal. Sometimes they call it the coronal plane, because when you get coordinated, they put the crown on you, and that divides you in the front half and a back half. So your coordination, your coronal plane. So I'll just draw a crown. Help you guys remember. And then lastly, we have tops and bottoms. If you cut the body and you make a top portion and a bottom portion, then that is the transverse plane. So the only special one is this mid-sagittal. Crin is discrete, like your hormones or your sweat. They secrete. Think of hypnosis for sleep. If you're nocturnal, most likely sleep or at night. Think of, was it narcoleptic? Their seizures cause them to go to sleep. And if you want, you can look up videos of narcoleptic dogs. They'll be just playing around, barking, all of a sudden. And then 10, 20, 15 seconds later, they wake up like nothing happened. They go running around playing again. Spiro's breath. Which system involves your lungs? Your respiratory system. Right? Something happened. There you go. Your respiratory system. So R-E-S-P-I-R-O. Respiratory. Amnio. Starch is just a bunch of sugar stuck together. So in your saliva, you actually have stuff that will break complex carbs into sugar. Pretty cool. What is barometric pressure? Right? All this air is pushing down on you. That's atmospheric pressure. So the barometer. You guys ever heard of the barometer? To measure atmospheric pressure, you use the barometer. So if the barometer drops, it's going to rain. That means there's a lot of water in the air. Bio is life, not bad. Chemicals. Together we got biochemistry. Study of life and chemistry. What type of watch has a bunch of dials on it. A chronograph, right? In order of time, chronological order. When you write down history, it's the chronicles, right? Those are easy. Any car people? You guys like cars? So if you put your car on a dyno, right? They let the wheels spin. That's because they want to know how many horsepower the car has, right? So force, when they put the car on the dyno, diagnostics. Fungi, easy enough. Fungus, mushrooms, yeast. Lact, right? Lactation is milk. So lacto, that all means milk. There's lactose, sugar in milk, galactose in milk as well. Have you guys heard of Geritol? Geritol is a vitamin for old people. It's actually really good because it's one of the only slow release vitamins that you can get on the market. Everything else your body doesn't absorb. Lith we had already for stones. A necro is death. If you watched Guardians of the Galaxy, the first one, they had necroblasts, right? Death rays. So they just named it, not death rays, because somebody else already used it. They just named it necroblast. Telo. Now you know what telo means. Telesurgery, surgery from a distance. Telephone, talking to people from a distance. Trope, food or nutrition. What if you are atrophy? Has anybody been in a cast? Their arm or leg? So if you don't use that arm or leg, it's without nutrition, it gets really skinny, it atrophies. Not too bad. That's the start of word roots. So what I recommend you guys do is make your flashcards. That way you can shuffle them and learn them forwards and backwards.